Hi everybody, welcome to our lip webinar. We are going to talk today about how to fill lips, how to fix them, how to deal with patients who are requesting certain procedures. Maybe you have patients who want bigger lips than you prefer to give them. All those kinds of ins and outs we'll be talking about in the next hour. I plan to leave time for questions and some discussion because I don't know everything. I think that when people start thinking that they know everything is when they stop learning. So I would never tell you that I know everything, all the ins and outs there are to know about lips and medical aesthetics in general. I'm always learning, which hopefully you all have that same feeling, same opinion. I also want to make sure that you know that I don't work for any of the companies, any of the pharmaceutical companies that we're going to be talking about today. All of the products or the techniques that we talk about today are things that I prefer. So things that in my 7 years of being in the aesthetics industry are what I like, and I'll tell you why. You may have a different opinion. You may like a completely different product for whatever reason, and I would love to hear that feedback. I'm always open to hearing about new things, products, techniques, all that sort of stuff. So my name is Wendy Pickett, and I am the CEO and the lead aesthetic trainer at Pacific Northwest Aesthetics Academy. We specialize in injectable trainings for all kinds of aesthetic procedures. So some of you I've seen at your offices, some of you have been to ours. We do offer private trainings at ours as well as group trainings and private trainings. We travel and go around other offices all over the United States doing training. So it's a passion of mine, and I love with the technology that we have now that I can talk to people all over the place and bring this knowledge and collaboration to everybody, regardless of whether we're in the same location or not. And I really feel strongly that collaboration between medical aesthetic providers is key in providing patient quality care and the safest possible care. So whenever we're training on anything, we always talk about safety first. And we're committed to doing that, and we will continue along that pathway of that being our number one priority. So we're going to just dive right into it, and there is a lot of content that I wanted to cover today, and I have a PowerPoint presentation, so we'll kind of be bouncing back and forth between all that. So as well as talking about, I've got some videos and a little bit of interactive things to do with you guys. So let me just get to, when I pull it up here, let's make sure that you can see this as well. So let me know if you can see the first slide of the PowerPoint presentation that I have, just with a hands up or an okay. There we go. Okay. I think you all can see that now. That is our first slide. Hi, Terry. So let me know if you can all see that in the questions. Great, great, great. So we'll be bouncing back and forth between the PowerPoint and me. So here we go with our webinar, Medical Aesthetics on Lips, how to fill them, how to fix them. So it's really interesting when we think about lips, and of course they are, I would have guessed that they are the number one procedure in the United States. I have since heard that cheeks are actually number one, but lips are number two, and they're picking up steam. The thing to remember about lips, I think first and foremost, is that it's not just the lips themselves. Unless you're dealing with somebody perhaps who is in their 20 to 25 age range, you have all those things around the lips that are going to contribute to that look that they're going for. So going back to the look that they're going for, having somebody sit in your chair and just say, I want perfect lips. And of course, perfect lips is something that is very subjective. Everybody might have people always have a different concept of what perfect lip is. So you may have somebody who sits in your chair and they start describing what they want their lips to look like, or they could just show you a picture of Kylie or Kendall, or gosh, I just saw Taylor Swift this morning. She's got beautiful lips, or perhaps Angelina Jolie. So everybody has a different idea of their perfect lips, and it's important for us as providers to explain the limitations to that, what we can and what we can't do, as well as talk about the things that are going to enhance their lips that is not actually focusing right on the lips themselves. So when thinking about that, knowing the anatomy of the structures around the lips is really going to make a big difference in enhancing what your patient's final result is. So these muscle groups that are around the actual lips are contributing to what the lips look like. Most notably, we're going to talk about the orbicularis oris first and foremost. That's our guy that creates those smoker's lines in the upper lip and lower lip as well. As we age, we can see the orbicularis, the contracture of the orbicularis oris really makes those lines more prominent. And by addressing that is going to be key in creating that look that your patients really want. So not only are we looking at the pink or the beautifulness of the lips, we are looking at the muscle groups around the lips. So the depressor angularis oris is that little guy down there in red at the corner of the mouth that pulls the lips downward. This can be apparent on people who are even in the younger age range, in the 20 to 25 age range, and just by putting a little bit of neuromodulator in that area is really going to create a nice, more of an upward turn at the corner of their mouth. So think about that. I almost now will hit the DAO every time I'm enhancing lips, because it just is the icing on the cake when you're giving someone more volume and more structure to the lips to give it a little bit of an upward turn. Some people have a very significant downward turn of their lips, and you may need 5 to 7.5 of neuromodulator on either side to give them more of a upward turn. I've never done so much neuromodulator in the DAO that they look like a joker afterwards. It is a pretty large muscle that you can be generous with your neuromodulator. The mentalis is a pair of little muscles that create that peau d'orange look, that little wrinkling, puckering effect in the lower chin. It also gives us that outward turn of the outward projection of that lower lip, and raises the central portion of the lips, as well as gives more of that bulbous chin sort of effect. So if somebody has that really bulbous chin right there, hitting that area with some neuromodulator is going to enhance the overall effect of the lips. And finally, just hitting on some more anatomy, I wanted to talk about the blood supply to the lips. When we're doing basic injectable training with brand new injectors, we talk, of course, a lot about vascular occlusion. And when we move on to the lips, something that we emphasize, because we're all fearful at first of doing lip injections because they are so prominent. It's the thing that people see first. But the fear factor as far as creating a vascular event should be minimal in this area. If your technique is perfect, if you're operating safely, as we all should be doing, you shouldn't have any vascular effect to the lips. Here we can see that there's circulation from both sides. You have a lot of blood flow to this area. I've injected lips before in the vermilion border, and I've seen an immediate blanching, and it reperfuses almost as quickly, like almost instantaneously. Is that a vascular event? No, there's no sequelae from that. What I have seen most recently on Instagram, most notably, is vascular events to the lips, and there's never a lot of explanation with that. It's one of the definite pitfalls of our social media, as you're giving little tidbits of information. You don't get the whole story. And so when I look at these photos of vascular occlusion events in the lips, I am not seeing something that makes me think that it was an immediate injection into the artery. It looks much more like these lips have been overfilled, and the edema that results from that is causing a compression of the vessels, which is then leading to tissue ischemia. So of course you're going to treat that in the same way that you would any other vascular occlusion event, and we will talk about using hyaluronics and vascular occlusion protocol later at the end of this presentation. But in the lips, if you are injecting it superficially, if you're not overfilling them, and if you're always keeping your needle in motion, you should be very safe in this area. Overfilling is a hard line. Many injectors want to be one and done, saying, this patient wants really big lips, let's go ahead and just put 3 syringes of filler in there. If you're not pre-treating, and if you don't give good post-care instructions to the patient, they may present back to you with a vascular event due to the edema. My preference as a very conservative injector is to take it in baby steps, to do 1 syringe initially, and then follow up 2 to 3, maybe even 4 weeks later. And so over the course of 3 or 4 months, getting my patient up to that volume that they want to be at. And I have no problem doing that. But I do like to take baby steps with that. So I am going to pop back to the webcam here, and we are going to talk about some products that are commonly used in the lips. Things that I like, why I may not like them, and just let me know if you've got me back on your screen as I pop back and forth here. I just want to make sure that all the technical stuff is happening. So let's talk about products in the lips. We'll just start with Belotero, which is has been around for quite a while. Belotero is a product by Merz Pharmaceuticals. I love Belotero for the fine lines of the lip, all around the lips. It's an amazing, amazing product. In the actual body of the lip, it won't give you a lot of structure, nor will it last very long. So I do love it for those people, my older patients who I'm treating smokers' lines and maybe just enhancing their lip volume a tiny bit with the Belotero also will give them a more youthful look. But I wouldn't primarily go with Belotero specifically for the lips themselves. It's more of a in the lips if I'm already doing some perioral lines. Or for your younger patient who wants to just give it a test run, maybe they just want to see what it's like, and Belotero is a really great option. Belotero is a Merz product, and then on the other end of another product very similar to Belotero, meaning it's also finely whipped, is our Volbella from Allergan. Volbella works in the same way in that it is more finely whipped, and it is intended for use in fine lines. Volbella is more expensive than Belotero, but one of the benefits of Volbella over Belotero is that it has lidocaine already in it, and it comes in a 0.5 cc. So if you want to go that route, if somebody doesn't want a lot of filler, they can do the 0.5 cc's of Volbella. You can use it in the exact same way as Belotero. I love both of these products in the fine lines. I wouldn't hesitate to use them. The other product that is very similar is from Galderma, and that is Restylane Silk. And I don't have it here because I do not use it in the lips at all. And the reason I don't use it in the lips is because on the times that I have used it there, it resulted in such severe edema that my patients actually had to go on a Medrol dose pack post-injection. The swelling was severe enough that it looked like an anaphylactic reaction, and that my patients, more than one of them actually, were not even able to go to work that next day because of the severity of swelling. When I contacted the company, they said that's sort of one of the things that silk is known for in the lips. And so for me, I just choose not to use that product because of that unreliability, the inconsistency. And I have other products that I like much better that are reliable and consistent. So we started with the more thinly whipped products, the ones that aren't going to last as long, but are really great for fine lines and really great for somebody who doesn't want a lot of poof, a lot of volume. So moving on from that, let's just talk about Versa really quickly. So Versa is our newest filler on the market in the US, and I love Versa. It's made by a company called Prolenium. And if you haven't tried Versa yet, I encourage you to reach out to Prolenium and have them send you some samples, because this product is amazing. The price point is low, meaning you can buy it and try it out. I don't know if they have a minimum order, and their name is very indicative of what it does. So Versa, meaning versatile. So if somebody comes in and they have a budget and they kind of have lots of different things that I feel they need to have addressed, lips as well as cheeks and maybe nasolabial folds, but they only have a limited budget, I can use one syringe of Versa, or maybe two, and I can do mid-face volume, I can do nasolabial folds, I can do vermilion border and some actual poofiness in their lips and give them some volume. It's a great product. I like that it's robust and can be quite rigid. So I would use this if I wanted to treat multiple areas and not worry about it not sticking around very long in the cheek area. I have several patients who request the Versa specifically for their cheeks. So when you compare, the counterpart to that would be Voluma. I feel like they're very similar in extrusion force and in your final result, in your final, what your patient looks like at the end of the treatment. So Voluma is at least 3 times more expensive than Versa. So for that reason alone, I go with Versa every time. I just think it's a phenomenal product. If somebody comes in and they only want cheeks, I'm not going to go with Versa. I'm going to go with something else that addresses that, most notably Radiesse, because I'm a lover of Radiesse. So eventually we'll have a cheek webinar, we'll have a tear drop webinar, we'll talk about all that kind of stuff later on too. So let's talk about the Galderma line of products. First, we have Restylane L, which we lovingly refer to as Restylane Classic, because this product has been around a very long time. We use this to do all of our trainings because the product is easy to work with. It's easy to dissolve if we don't like what we've done. It's just the gold standard, and it's reasonably priced, so it doesn't cost us a ton of money, and so therefore it won't cost your patients a ton of money either. And the other things that I love about Restylane is that it's small. It comes in, my hands are small. You know, I don't know what the percentage of female injectors are, but most of our female injectors also have small hands, and I just really love the ease of this, how it's structured, and the smaller syringe is nice. So the other Galderma products that I also love in the lips and anywhere else are the Refine and the Define. And so if I'm doing someone's dynamic lines, and with Refine and or Define, so Define is for our deeper lines and Refine is for our more fine lines, but those ones that we see in animation, I can also enhance the lips with those products as well. So those are going to be a multi-treatment area product. If I'm doing lips only, I'm not going to choose Refine or Define, only because the price point is much higher than just Restylane L. So Refine Define is something that I do love in the lips, especially because they are so elastic that the movement when it's placed in the lips is really nice. But it would not be my first choice for lips only. It would be only if I am doing other areas as well. So comparing our Allergan product to the Restylane Classic, we have also the gold standard is Ultra XC, which is also a hyaluronic acid product. Again, all these are HAs. And so this is going to be our Juvederm Ultra XC. It also has lidocaine in it. So this is also another gold standard that is used frequently which is great. And then moving on from that, we have Juvederm Ultra Plus XC, and this is more of your Kylie Kendall lip. So if somebody comes to you and they want that immediate gratification of going from little tiny lips to big, huge, poofy lips, this is the product that I am going to go with. And it's great, super reliable, love, love, love it. And then I talked a little bit about the Voluma, and that's this product, which I would never, ever, ever go choose this off my shelf specifically for someone's lips. This is what I would just do maybe a little bit in the lips if I'm already doing cheeks. This is the most expensive product in the US as far as HA fillers go. So it is cost prohibitive for me to put this into someone's lips. I can get the same or better results with a different HA that the price point is much lower. So we've talked about just about every filler on the market here in the United States. The ones that I didn't mention, number one, most notably, is Radiesse in the lips. That's just a no. Radiesse looks like concrete. So to me, it really makes common sense that you wouldn't put it in the lips. So concrete in the lips, it just doesn't make sense. So Radiesse doesn't belong in the lips. The other things that I didn't talk about are our biostimulators, which I don't call fillers at all. You'll never hear me call them fillers because they are not. They are biostimulators, so they're going to stimulate our own collagen production, and that's Sculptra and Bellafill. Not doing that product in the lips at all because of our concentric muscle groups. They act as similar to an oyster with a pearl. So in those areas, your biostimulators are actually going to create nodules. And sometimes those nodules don't develop for years after the treatment. We've seen them in our office. We have had patients come in and they say, I had Bellafill or Sculptra injected into the body of my lip, and now I've got these lumps and these bumps. Well, unfortunately, it's quite complex to resolve that issue, and most times it involves a plastic surgeon doing an excision. So just steer clear of that. The other things that I have seen people do recently on Instagram, PRP, PRF, PRFM, it's all basically spinning down your blood and then re-injecting it in areas where you want to stimulate growth. Does it work? You know, I don't know. I haven't used it in my practice. I probably will never use it in my practice because if someone wants lip enhancement, I will go with an HA filler that's going to give them immediate results that last a good long time. And HAs can also stimulate collagen or tissue production to a certain extent. And we all know that anytime you are poking needles into the tissue, you're going to stimulate some cell production anyways. So all of these HAs typically last around the same amount of time. So my general wording is 6 to 9 months, sometimes longer, sometimes less. That gives a really broad guideline, yes, but after treating thousands of lip patients, I can very easily just spout that out, and they're super happy if it lasts longer, and they've already got the realization that if it doesn't last as long, that they know that. They have heard that already. So, but they're all typically about the same. The Voluma studies that go back and when they first came out with Voluma and saying that it lasted 3 years, that was based on 5 or 6 syringes of Voluma at one sitting and then a touch up again later on. So always look when you're talking to your reps, make sure and discuss the longevity of the products, but how they reach those conclusions, how much it was, what the volume of the product was. I could put 6 syringes of anything in someone's face and it's going to give me really good longevity. So that's, at the end of this, we can talk more about the different products, but they really pretty much, you know, all the same. They're HA products. Your Bellatero and your Silk are the ones that are a little more finely whipped that won't stick around. They're going to be the ones that are going to be more like completely dissolved at the 6-month mark. Most of the others I see 9 to 12. My consistent lip patients would typically come back to me about once a year. So let's bounce back over to the PowerPoint, and we'll talk about some pre-treatments that you can do for your patients before they actually come in and see you, which is something that I've found to be really helpful. So before they come see you, some pre-treatment considerations. Of course, we have all been through basic training, so I'm already bouncing ahead. This presentation is not for the person who's never been taught how to properly do lip injections. So pre-treatment considerations, you're going to have your patient is coming in, making sure that they avoid medications that will thin their blood, which a couple days before, but gosh, if you can get them 2 weeks prior to stay off that stuff, their chances of bruising are going to be even more minimal. Arnica tablets can be quite helpful. You can find them anywhere, most notably in health supplement stores, and they can minimize bruising if you have your patients take that. Pre-treatment a week ahead of time would be great. Zantac and Zyrtec. If you get nothing else from this webinar today, take this little bit of info with you. I have seen this work, dare I say, miracles in my lip patients, pre-treating with one Zantac, and these are over the counter, Zantac, Zyrtec. And when I say those two, I'm not endorsing any brands. There's generics available, but you want an antihistamine and a histamine blocker. The reason that I advise my patients to take Zantac and Zyrtec is because they both start with Z, so they're easy to remember, and the Zyrtec does not cause drowsiness. If they're my last patient of the day, I will tell them to take Benadryl when they get home or before they go to bed, because using an H2 blocker, an antihistamine, is going to decrease the inflammatory response, which minimizes swelling and speeds healing. So have them pre-treat with one Zantac and one Zyrtec an hour before their appointment, and then every day for the next 72 hours, if not 2 weeks. You will see an amazing effect on the number of patients that you have that have a lot of swelling and or a lot of bruising. I've had several patients who had no swelling at all when they pre-treated with the Zantac Zyrtec 30 minutes before their treatment. And of course, if a patient is known to develop the cold sores, you're going to want to pre-treat with an antiviral medication that hopefully they already know about. And if it's something that's occurred to them that's brand new, then you're going to want to get them a prescription for usually acyclovir. And then another thing that is really going to take your lip injections to the next level is doing a general oral block. If your patient is willing and they are not allergic to lidocaine, doing a 4 cc with 1 to 2% plain lidocaine block into the oral mucosa is going to make their treatment so much more comfortable, and you're just going to be a rock star because of that. It's not something that everybody does, so by doing that, you can really increase the number of your patient satisfaction. So a lot of people, when I learned this, I was like blown away at how simple it was. So I just want to go through it really quickly. And this is within the scope of practice with nurses. We have to have a medical director, of course, but learning this procedure shouldn't be super complex for you, and it's easy. So if your patient is agreeable, go with that. Otherwise, you're going to put your topical anesthetic on their lips. I would suggest for 30 minutes. Pre-icing is also a nice way to go. But now I've gotten to the point whenever I see somebody wincing or grimacing in pain when their lip injection is happening, I'm like, why are you doing that? Those poor patients. And then when I hear from people who come to me from other providers and we're talking about lips and they're hesitant because of the pain factor, I always offer the lidocaine general block. So I've got 4 cc's of 1% lido in here. I would prefer 2%, but we've been having difficulty getting that. 1% works well. I had this done on my oral region a month ago, and you could have done a root canal on me. It is that good of an anesthetic in patients who are sensitive to it. You might want to draw up a little bit more in patients who say, oh, the dentist always has to numb me up several times, so maybe they're a little bit lido resistant. So pull up an extra bit for them. You're not going to overdose them with lidocaine. So where we're going in this with your lidocaine general block. And we're not going to a specific nerve. We are going, let's see, this is a Brevi board, which I adore. If you guys, it gives you all the musculature. It's really good for your neuromodulators, but it's also a really nice way for me to illustrate where you're going to place your 1 cc in each location up in this region. So you're going to go open, just grab the upper lip, insert your needle in here, and so you're going into the soft mucosa here, right into the cheek area. So you want to aim towards the infraorbital foramen where our nerve branches come out, but you're not trying to hit a specific nerve. So you're not using your 1.5 inch needle. You can just use your 27 gauge 1/4 inch needle and just kind of get a nice bolus right in that whole area. Same thing on this side. Down here for the lower lip, you want to aim towards that where that mandibular nerve is over on this side. So 1 cc down in this direction too, lateral of the incisors, and you're going into the mucosa. So you're not going into the gum, you're not going into the junction, you're actually going into the mucosa of the lip, and they will numb up really nicely. I've had some people tell me that disfigures the lips, and I haven't seen that in my practice at all. I do my assessment before I do the block, so I'm well aware of the treatment plan and what I want and what the patient wants. So we've already discussed and developed our treatment before we've done the lidocaine. Yes, of course, the patient will feel numb. They won't be able to smile very well, but once that wears off, which is typically about an hour, doesn't last very long. Once that wears off, they're super happy. And I just really encourage you to start putting that into your treatment plan protocol whenever you do lips, because your patients are going to love, love, love it. So those are some just kind of helpful pre-treatment things. And then let's move back. So here we go. Next up is assessment and consultation. And I love this picture, but I hate those lips. The photos that I found today, you guys, I wanted to share that with you as well. It's from a website called unsplash.com, unsplash, U-N as in Nancy, splash.com. So these are free pictures that you can get and use them on your Instagram, on your social media, on your Facebook page. It is just really super cool. I found these really great lip photos that have definitely enhanced this PowerPoint presentation. So when we're talking about the assessment of someone's lips and we're doing a consultation with them, you're going to want to first and foremost always, let's just go back to the basics and talk about structure. If somebody doesn't have structurally sound lips and you just start filling them up, they will look like this. I just call these hot dog lips. The structure of these lips has not been addressed. So always, always, always address the structure. And then the proportion, like how big, how small, what do they want versus what they have, the volume themselves, like how much are we going to put in these lips to give them the result that they desire. Talking about balance, upper to lower balance, as well as balance with the other structures, the eyes, the nose, the jaws. Symmetry, as right to left symmetry and upper to lower symmetry. And then finally, projection. All these things, once you start doing lots and lots of lips, should happen concurrently. But projection of lips is also something that you want to address. We all want a nice little outward projection. As we age, which we'll see in the next slide, we will see what happens to our lips. And projection is one thing that is really key that contributes to us looking much older. So if we can create more outward projection, of course, we can create a much more youthful effect. So in this particular set of lips, if this person walked into my office, I would first and foremost address the structure of these lips and give some filter columns, maybe try to enhance that cupid's bow a little bit. It's a little bit hard to tell with all the gloss and color on there, but I'm assuming that it looks very much like she has no structure to her lips. So when we're talking about the anatomy of the lips, just to emphasize and to reintroduce you to the anatomical terms that we'll be talking about today. The filter column, Cupid's bow, the vermilion border. If someone has a weak vermilion border, you're always going to start with that first. That is structure, and that's what we need. And you can see on these lips how our humans anatomically have a little bit smaller upper lip and a little bit larger lower lip, and we naturally taper out to the corners. So we can start off wide in the center, and they naturally taper off to more thin at the corners. The hot dog lips is when we are completely the same width all the way across, and we get that pontoon look. So here's a really great slide on signs of perioral aging and what happens as we age, which all these things around the mouth contribute to what happens to the lips. They actually will get thinner and turn under because of these outlying structures and the muscle groups that are affecting the lips too. So let's talk about our aging patient and what we would want to do with somebody who presents to you like this. And you, of course, will want to address the lips. And even if we did say a little bit of Bellatero here, our patient is probably going to be pretty happy. She's going to look a little bit more youthful, but long-term plan should include addressing all these things, all these signs of perioral aging that are happening here. So we are seeing everything that we just talked about in the previous slide. And the fine lines is definitely something that I would address first and foremost with this patient. So I probably would choose Bellatero and start hitting all those fine lines that she has around her mouth, as well as addressing her skincare that she might or might not be using. So looking at balance with this patient and balancing her lips with the rest of her face and all the volume loss that she has here. When I show this to a lot of my sculpture patients, because this woman is an ideal sculpture candidate because she has so much volume loss. She looks like a raisin and we want to fill her back up. Or a deflated balloon is another analogy that I use when I talk about a patient like this. So structure, let's talk specifically about the lips. The structure of this patient's lips has completely disappeared because of everything that's happening around her lips. So just by addressing her vermilion border, she's going to get a more youthful look without getting overfilling that a woman of her age is not going to like. She also has severe tissue laxity. So adding more, addressing her tissue specifically with the Sculptra again, or pulling up the lax tissue with our PDO sutures is going to be something that we're going to discuss with this patient. And the support, so our support system here in her cheek, she's got very flat cheeks. So by support, I mean, again, supporting all the structures by enhancing what we can with a in non-surgical way. If a plastic surgeon saw this lady, of course, he's probably going to want to take her to the OR. This patient doesn't want plastic surgery. She wants natural enhancement that we can achieve from using our aesthetic injectables. And then finally, the texture of her skin. We would be doing our patient a disservice if we didn't address the texture of her skin as well. So popping really quickly back to perioral and using some Bellatero in those areas, I wanted to show you guys a quick trick that I love with Bellatero. Oh, you can do it with any other HA filler as well. And we will be talking about doing this specifically when we are doing the pillar technique, which is coming later. So pull your plunger out of your insulin Botox syringe, and I just hang on to it to make sure that it stays sterile at the end there. And then I have a 16 gauge on my Bellatero syringe here. So what we're going to do is take that 16 and put it right into my Botox syringe like that. And I'm going to push the product in like that. Pull this back out. All of this is remaining sterile. This was literally life-changing when I learned this procedure. Then you're going to take the plunger and push it till we have our filler in our syringe. Now this is a 31 gauge, 5/16 syringe, and now I have my Belotero in here. And I can quickly and easily go along the upper fine lines in the lip, the perioral area. And Belotero is a very superficial injection, so this little trick works really well for just hitting. You can just go all along super quick. You're going to want to do the oral block for your Belotero patients because, again, it does not have lidocaine. So be nice to your patients and numb them up really well before you do this. But this is a super great little trick. I like it especially because, again, my hands are little and it's really easy for me to maneuver this. I will load up like 3 or 4 or 5 or 6 of these from 1 cc syringe of Belotero or any other HA filler and just have it kind of ready to go. So you can do it pretty quickly and it's a lot of fun. So hopefully that helps you guys as you move on. I encourage you to give that a try. So we've talked a little bit about all that, and so let's talk a little bit real quickly about treatment plans. This patient walks into your office, and just by looking at her straight on, we can see that she doesn't have philtral columns. I like the volume. She doesn't have a whole lot of shape in that upper lip. So my initial assessment, if I'm only doing lips on this gal, I am going to address her philtral columns. And she's going to be a pretty easy fix. And this one, the center picture, although a little bit grainy, we can see that she's kind of got thin lips. She has some perioral lines interrupting her border, but she's got a nice shape. So this is going to be a pretty simple patient as well, addressing the vermilion border first, and then creating some volume, most notably in that upper lip. And you can see where she has some lines actually in the lip itself, in the tubercle area. So this last patient who just looks like she's got phenomenal, beautiful lips, which she does, and she wanted more. She wanted enhancement. She just wanted them to look better. So beautiful filter columns, amazing structure. So at first glance, you would think, I'm not going to touch those lips. But when you look at it from the profile, you can see that she has a definite need for some outward projection here. Her upper lip is almost exactly in line with her bottom lip. So giving a little bit more outward projection to the lower lip by increasing that vermilion border and putting some filler into the actual body of the lip is going to create a much more balanced, pretty look for her. And looking at the chin as well, her chin's a little bit recessed, so we can add some filler in that area with some boluses right on the bone to give her more of an outward projection of her chin. So not only are you going to assess your patients from forward facing, but always look at their profile and see what kind of enhancement they need. So beautiful lips have ideal balance, right? We've all heard about the golden ratio. So we like 1/3 on top, 2/3 on the bottom, or you can go with the 1 to the 1.6 ratio. And thinking about the balance of the lips with the other structures, the eyes and the jaws and the nose, or do they have perfect balance or ideal balance? You do you. If you want to start doing some of the things that are more out of the box when it comes to aesthetic procedures, go for it. The thing that you need to remember is that that's your name on that canvas. Your patients are walking out of your office with your name on their face. So you just really need to think about the image that you want to project, your brand, your marketing. This particular patient here was an example I found of a 50-50 lip, which means upper lip, lower lip equal. In her case, I would actually argue that that might be a 60-40 lip or perhaps a 70-30 lip. If this patient walked into my office, I'd probably suggest dissolving some of that upper lip. However, that's clearly not what's happening here. So when you hear 50-50 lip, that's what this is referring to, is more of an equal upper to lower look. And it's very popular in social media right now. And having how you want to address that before that patient actually walks into your office is probably a good thing to do. And I've been in this long enough to know that I don't choose to do that. And I will talk to my patients and educate them on how and why. And then I will talk about gorillas, orangutans, baboons, fish lips, duck lips, all those things. And I just like to stay conservative. I prefer a more natural look. So no orangutans, baboons, monkeys, 50-50 lips don't belong in my office, but for other people, providers who want to do that, I think it's great. You do you, and hopefully we all ride this wave of aesthetics and lips in particular as long as we can. This is what I prefer, is a nice augmentation to these lips, nice outward projection. I love how adding some HA filler really makes the texture of lips change. They look more moisturized and hydrated. They just look beautiful. Here we have, again, some pictures from the Unsplash that I was talking about. These are beautiful little rosebud lips. Look at the structure here, the filter columns, the vermilion border in our first model. In the center, again, she's got these cute little rosebud lips and enhanced nicely. What you need to remember and educate your patient on is you're not going to take somebody who's got these little Cupid doll lips and make them into a super broad Kendall and Kylie lips. That is nearly impossible, if not impossible. So somebody who starts with structurally sound lips like this, you can definitely add some enhancement. What I love over here with our brunette on the other side of the screen is she's got that keyhole pout, and I'll show you how to do that. Also, pretty lips. Over here on the next slide, we have what I see as a very youthful model with non-touch lips. These look like virgin lips to me. She's got perfect symmetry, perfect balance, a nice structure. This is what I go for, are lips that look like this. And then here in the center, I like this photo because we see here on the lower vermilion border how the border dips in. That can be a challenge to pull out and make rounder. If your patient wants that, just lay a thick strip down right along where it divots in there and give it a nice pinch between your thumb and your forefinger to try to get that outward pull. They probably will, of course, line their lips because the pigment may not be coming out to that extent either, but a lot of people prefer this. I try to talk my patients who have that already into keeping that because I think that that's just a gorgeous set of lips. Over here, our next model has thin lip on top. Hopefully you can all appreciate that. Those are going to be pretty simple lips to fill by starting with the upper lip and then kind of going up and down until we have balance and the results that this patient desires. I'm not sure what I want to say about these lips. I do know that if this patient walked into my office, this gentleman walked into my office and wanted any more filler to his lips, I would tell him no. I would tell him his lips are already quite beautiful and full, and if I made them any more full, he would look ridiculous. But that works for him, and that's what he's going for. So, and the same thing with this lovely model, also who looks quite young and has very full lips. I would stop right there. I wouldn't want to add any more to that patient's lips. So how do we get the perfect lips? Tips, tricks, and new techniques. Let's talk about some things specifically. And when we do the HA filler into the Botox syringe, you won't have the bubbles develop. You can push the plunger down and it'll push all the bubbles out. When you're actually injecting the product into your patient's fine lines, you will have a little bit of pushback, but it's super easy to get the hang of it. And you're going so superficially that you don't even notice the bubbles at all. So let's talk about the pillar technique, the lip flip, keyhole, and then finally needle versus cannula. And so the pillar technique is where we start with a syringe or a Botox syringe or your regular syringe of your HA filler, and I prefer to do it with the insulin syringe. You're gonna lay your patient back. So the pillar technique refers to, I've got this set of lips here, you guys, isn't this great? I just love these. So here's our set of lips. So the pillar technique, you're actually gonna come in at the vermilion border and go straight down into where you see these striations. So your patient will have these creases down their lips, right? Like this and like this. They may be completely interrupting the vermilion border, or they might just be in the pink itself of the lips. So laying them back, coming from up above and going right under that crease in the body of the lip and laying down a strip of it and doing the same thing as you go along and go along. So this is called the pillar technique. So you're just going to go, and there's videos online that you can watch of this. So you go in here and you're just laying down a strip. So that's called a pillar technique. So that's giving some support up in those structures and eliminating those lines. Pillar technique. The lip flip, which I just think is the best thing ever. We've been doing it for years, right? But somebody just coined the term the lip flip. So if somebody calls your office and they say, does your injector do the lip flip? Make sure your staff knows that yes, you do the lip flip. So a lip flip is just enhancing the lips with your HA filler, but also using your neuromodulator to give even more of an upward flip, because the orbicularis oris, it contracts and it pulls the lips down. So if you can relax that muscle and pull the lips up, you have an even greater look. I mentioned this earlier, I've been doing this with all of my lip patients just to enhance the overall look of the lips. It's phenomenal. And then as their filler maybe starts to wear off, just keeping up with the neuromodulator can extend the look. So what you're going to do is target the orbicularis oris, upper lip, have them pucker first so you can see where they're contracting. You're going to have them pucker, and then you're going to just hit your orbicularis oris on top with 1, 2, 3, 4. Wherever they're contracting, you're going to want to hit with just a little bit of your neuromodulator. And then down below, again, if they're having some interruption of those little lines into their lower lip, you can hit down there as well. It's key not to do too much, right? Or they're going to look like they had a stroke. And it's also key to let them know that they're going to feel like they might be a little bit numb. And if they try to suck on a straw, they may notice they won't be able to pucker as much. But the lip flip is a really great way to enhance the lips in general. And you could just give it a try. If you're only using 5 to 8 units of your neuromodulator, adding that on and comping them that, they're going to love you. The next treatment, of course, they're going to pay for it. But the first treatment, you're going to want to just comp them and like say, oh, let's give this a try. You may love it. And kind of tossing them a bone that way. Also, you want to think about word of mouth. So if you become the injector who gives painless lip injections and you do the lip flip and you enhance and augment beautifully, you're going to be the go-to person. So let's talk about the keyhole. So this is really fun. You can do this a couple of different ways. What's really handy to do is to grab your dental floss. So I have some dental floss here. You're going to put a knot in it. So I've got a knot in my dental floss, and then I'm going to put it between my patient's lower teeth. I'm going to have them hold it, like this. So they are creating this divot right there in the center of their lips, and they're going to pull it pretty taut. And you are going to come in on this side with your syringe, and you're going to inject here, and you're going to just lay down strips all along there, not going over this line. And they're going to be pulling it taut, so you can't go over that line. The other way of doing that is with your long Q-tip, your long cotton swab, and having your patient hold it again right there in the center. And you're going to do the same thing. You're going to come in from the side and lay down strips of filler in that area to create that pillow in the tubercle here and a pillow in the tubercle there. Really beautiful keyhole look. Lastly, we'll talk about needle versus cannula. Restylane Silk was FDA approved to use a cannula, and I don't use cannulas. I like the precision that needles give me. So here's our cannulas. I want to know if you guys use cannulas. I've got yes, no, or sometimes. The only times that I use a cannula if somebody insists on having their lips done and they have a cold sore or something, and I'll go outside of there with the cannula. Otherwise, I'll make them wait. So I think, can you guys see the poll here? So go ahead and answer really quick. Do you use cannulas when injecting the lips with dermal filler? Yes, no, or sometimes. I guess I would have to hit sometimes on this, but typically I wouldn't. So answer that if you could really quick, and we'll keep moving along. So it looks like most of you don't. There's 78% of you who don't use cannula, and I'm guessing it's probably the same for the same reasons that I do. I just love the precision of a needle, and if you think about why we would use a cannula, it's to decrease bruising, it's to minimize pain, and it's to prevent vascular occlusion. Well, we've already talked about reasons on how to prevent all those things from happening. So if you are following the guidelines as set forth so far, you should be fine with that. So thank you for answering that. We'll close the poll, and let's go back to the PowerPoint presentation. We're kind of running out of time. I want to get through this. And I have a video. Another advantage of using cannula is you can do the single point entry, and so you're only going to use the 1 point to do your injection, but you're still using a needle, right? So you still could have some bleeding and bruising, and especially if you're using a 27 gauge cannula, those can be quite sharp. So here's a really good way to do one insertion spot. It's a 27 gauge 1.5 inch needle. So as you become more accustomed to doing dermal filler in the lip, this is what you could do if you really want to stick with just one insertion spot, and you can get that whole length of the vermilion border with this 27 gauge 1.5, which is a really good way to do it. Super quickly, we are going to move on to, this is another depiction of a method. I don't do lips the same way twice. This is, if you follow these 1, 2, 3, this is a nice way that somebody has shown how to enhance the tubercles and didn't treat the philtral columns, but by treating the vermilion border, it caused this nice philtral column effect. So this you don't have to do it cookie cutter. Just get accustomed to doing lips, try different things. But the reality is sticking to the basics is going to ensure you maximum success. So knowing your anatomy, identifying facial qualities in particular people and what they're going for. Facial aesthetics is key. Talking extensively about your patient's needs and desires and making sure you're collaborating with them. You're not following exactly what they want. They aren't just being led by you to get what you want. You need to work with your patient and collaborate together. Superior injection technique. Understand and explain your limitations, and you are the expert. So let's talk about fixing some lips. The first thing you're going to want to do is massage. Someone comes to you with a lump or bump, you're going to try to massage that lump or bump out of there. So dissolving with hyaluronidase, a little or a lot. If you use a lot of hyaluronidase, you are going to eliminate their lip volume completely. Always start with little bits. There's no standard guidelines. You're not going to overdose somebody on hyaluronidase. So just start with a little bit, little baby steps, and then go from there. If you have a vascular occlusion event, I just had someone ask me, what does flood the area mean? If you have a vascular occlusion event, flooding the area means using every cc of hyaluronidase that you have in your office. Canalog can be used to break up the hyaluronic acid if all other methods fail. Referral for excision would be something that you likely would do if somebody's got Bellafill or Sculptra in their lips, but always consider tincture of time first. I don't touch someone's lips until they're 2 weeks, sometimes 3 weeks post-treatment. So always just make sure and emphasize patience with your lip patience. So here's just a couple lips that I have encountered in my career. This older lady that we see, I don't even know what happened. She's been to a handful of different injectors. She doesn't even know what she has in there. This is somebody who I would flood her lips with hyaluronidase and try to get her back down to baseline, with the understanding that she's had such volume in there that she may have maxed a lot of skin laxity and she may eventually need a plastic surgeon. The other younger set of lips was actually a trauma patient who had her lips reconstructed. She completely lost her vermilion border. And then before she came into my office, she'd had them filled and overfilled and tried corrected and this and that. And I mean, it just was a disaster, to the point where she really liked how her lips looked, but I was always trying to achieve more structure with them. And we worked together for a couple of years, and eventually she did go again back to a plastic surgeon and came to me to do her pre-surgical dissolution of all the stuff that she'd had in there that had accumulated over 5-6 years. So we flooded the area, got rid of every bit of hyaluronic acid that we could, and then she went to the plastic surgeon to have a surgical fix to these lips. So a little bit more about actually fixing lips. If you have a patient come in and you're fixing their lips and they came from somewhere else, we charge for that at our office. But if I'm fixing something that was a result of my treatment, of course I don't charge for that. This is your hyaluronics. You have to have this in your office. If you don't, you're setting yourself up for a lawsuit and huge issues. Just have that in your office. We recommend keeping 4 vials of hyaluronics, which is a total of 4 to 8 cc's, depending on what size bottles you have. Those have to be refrigerated. So the other things about dissolving lips, just remember that if your patient wants their lips dissolved, that they may even go back to even less than baseline, because hyaluronidase actually dissolves our own tissue as well. Do you guys have any questions? That was a lot of information in a short amount of time, and I hope that I gave you some pearls that you can now take back to your practice and make your lip enhancements even better. One thing that I was looking at when I did like a quick selfie before we started this webinar, and I put it on my Instagram page, my new Instagram page, I hope you all follow, is called PNW aesthetic _trainer _Wendy P at Instagram. So I'm hoping to be a lot more active on that page and post things that I do for my actual trainings. And I looked at how I talk, and I smile and I talk kind of lopsided. And we've tried to fix that, myself and my injector, several times, and you just can't do it. So I've tried neuromodulator, I've tried all these things. So I think now, in the world that we live in, trying to really get your patients to embrace the things that we can't change, whether it be a lopsided smile or a beautiful rosebud lips, or those things that they feel like they want to change, but that you feel are a natural part of them, of who they are. So let's filtral columns is really super easy. There's a couple different ways to do filtral columns. Don't overfill filtral columns though, or that will look ridiculous. So I'm talking like just a 0.1 strip or even a 0.05 strip, just like a rip, rip. So you're going to start at the tip of the cupid's bow. So if we're looking at our anatomical, these lips just crack me up. So you can get these on Amazon. This is the face exerciser, right? Have you guys seen this? You can go on Amazon. This is supposed to exercise your face muscles, which we don't want bigger face muscles. We want smaller face muscles. I don't even know how these are selling. So you're going to go right into the tip of your cupid's bow, and you're going to aim. We're not straight up. Filter columns don't go straight up. They're at an angle. If you can't see them on your patient, have them pucker. Usually when they pucker, you can see the remnants of their filtral column. So you're going at the tip of the cupid's bow, you're aiming your needle right up there, and retrograde, right? As you're pulling your needle out, you're laying down just a very thin strip, and you're coming over here. To enhance them even more, you're gonna put your Q-tip here, and you're gonna grab and pinch like this. So now you're creating, even more structure there and giving them that nice little filter pump. They're going to have some swelling initially, so they may just kind of go, I don't know how I like that. Just really tell them that they are going to love it once it settles down. And if they don't, you can use a tiny bit of hyaluronidase to dissolve it, but they are going to love it. Trust me. Lidocaine block, what gauge of needle length do we use? I just use whatever I have left over from my syringes. So usually it's a 27 or a 30 gauge, 1/4 inch. Again, we're not getting up very high. So you're going in here, going, and so my needle is like right here. And you're just pushing it in with a plunger, 1 to 2 cc's of your lidocaine, just right in there. And you'll get a nice general field block in this region. So you don't need a long needle. I started originally when I was doing them, I started using a 1.5 inch, and you don't need that. It's not so much. Treatment of the melamental rhytids. Same thing as any other rhytids. Look for that muscle contraction that's contributing to the rhytids, but superficial injections of your finely whipped HAs are going to be good in that area too, as well as your neuromodulators. So do I ever add lidocaine to Versa? If so, how much? I am not a fan of putting things into my product because there's so many to choose from. If my patient is super hypersensitive to pain, I'm going to block them. If for some reason they don't want to block, I'm going to use my topical anesthetic, and I'm going to let them know that my Versa doesn't have lidocaine in it, because I'm choosing the Versa for these specific reasons. And if I dilute it down with lidocaine, I'm not going to have those properties. Yeah, I mean, I can kind of figure it out, but I like to do things easily. So yes, you can add a little bit of lidocaine to your Versa in 0.5 or even less, 0.25 would be plenty. And using the method of going syringe to syringe, using your male-to-male connector and getting it nicely mixed in like that, you can do that. But if somebody is adamant about having lidocaine in their product, I'm going to choose Restylane Classic or my Juvederm Ultra. So that's a little bit about that. So Laura, we don't have Restylane Kiss in the United States, but I wish we did. Europe has a lot more choices than we do here. So everything that you saw me hit on today, all of those different fillers, Laura is from Iceland. For those of us who weren't here at the very, very, very beginning of this presentation, we don't have Restylane Kiss here, but hopefully we will. Galderma already has quite the lineup for me. I feel like it's taken me 3 years to get a handle on what all these different products do and how they fit into my practice. So is it true that the weight of filler in the lips over time can elongate the upper lip? That the weight of the filler in the lips over time can elongate the upper lip? I'm not sure about that, but maybe. I mean, if you think about the long-term how we age and how our skin becomes more lax and will just naturally elongate, and over time meaning years, or are we talking months? So that's a really complex question. If I had a patient who asked me that, I would probably say maybe. But if it's something that you don't like, that elongated lip shape, like somebody who has that beautiful rosebud and they don't want that elongated shape, I would just say we're just going to have to play it by ear and see how it goes. Everybody is so different, and your people in your 20 to 30 age group, their skin elasticity is vastly different from your 50 to 60. So how their skin bounces back, like the picture I showed you of the herniated lips, that patient is in her 70s. So is she going to, dissolving all that with hyaluronidase, is she going to bounce back from that? Not likely. So when thinking about that, over time, if the lip filler is going to elongate or change the structure of the lips in some way, you're really going to want to think about the skin in totality, how elastic their skin already is. But that's not something that you're going to encounter frequently. This was awesome, you guys. If anybody else has any questions, I'm totally fine with sticking around and talking about them. Or if you have anything that I didn't hit on, perhaps there's a new technique out there that I haven't heard of yet. I am frequently on Instagram looking at all the things, not only in the US, but in Europe and Korea, all over, I like to be on the cutting edge and hear about different techniques and learn about them so that I can pass them on to other providers as well as my patients. And my Instagram account is PNW, so it's Pacific Northwest, PNW aesthetic _trainer _ Wendy P. You can also see a lot of what I do and my patients on our company's Instagram and Facebook page. So that's PNW Aesthetics Academy.com. And also that's our Instagram page as well, PNW Aesthetics Academy. And I would love to follow all of you if I don't already have you. And this broadcast will be posted on our website and on our YouTube channel. So if you know anybody who you think might benefit from watching this video, please send them to there. It will be free on our website. Just hit the link and it'll send you to YouTube and you can watch it again, share it with all your friends. And again, we want to support you also. So please don't hesitate to reach out, email, call, text. Let me know your Instagram page and your Facebook, and we just want to be here to support you guys. And like I said at the beginning, I think collaboration is what's going to bring us all up to the next level, as well as provide our patients with the safest, most effective treatments that we can provide. Let's see, just some last questions. I'm so glad that you guys liked it. You'll be receiving a follow-up email. And so if you could respond back to that and let me know, we'll be doing lots more of these webinars at least once a month in the future. Our next webinar will be April 11th. Well, we will talk more in-depthly about facial assessment, facial mapping, really fine-tuning your consultations and your assessment to create excellent, superior treatment plans for your patients. I think during our basic trainings and even our advanced trainings, we're so technique driven that we have to we don't give enough time to actually talking about the consultation and facial mapping and all that stuff that really goes along to creating the best care plan for your patients. So that will be April 11th. And that will be with Kathy Kramer at 9 a.m. Pacific time. So be looking for the email blast and the Instagram posts about that opportunity. I think it's going to be really great. And then moving on from there, we'll start going even into more intricate areas, like we'll do a whole webinar on tear trough enhancement, jawline enhancement after that. And please, if there's anything that you want to talk about or you want more information about, we would love some suggestions for future webinars and educational events for all of you guys. So you all have a great day, and please don't hesitate to reach out to me for anything that you might need in the future. And I hope to see you back here again on future webinars.